Perform hand washing before the contact with your patient. Greet your patient warmly and politely. Identify your patient. Take an oral informed consent. Explain all the steps of the procedure to your patient and your family present. Provide privacy. For example, Mr. Smith, I am going to do a physical assessment and I want to start with your head and follow down to your feet. Is it okay? Prepare all the equipment on the procedure trolley. The equipment is sterile cotton wool balls or napkins, disinfectant solution, gloves. Sometimes we use gloves for stethoscope, manometer, light pen, spot. Clarify any inconsistencies. Check sterile equipment, dates of exposures. Perform hand hygiene and apply clean gloves. Manipulation can be performed with disposable non-sterile gloves. Use semi-polars or polars position of your patient. Head of the bed is elevated 45 to 60 degrees. Use ABC algorithm before physical assessment. A. Patient is talking to you. Airway is opened. B. Breathing is regular and free. C. Circulation. When you check patient's identifier, you check the skin. The skin is warm, pink, and dry. The circulation is intact. This is not emergency situation. You can start assessment. Perform the basic safety assessment of the environment. You look around the bed. You cannot see any ampoules, needles, tubes, wires, pills on the table, etc. Assess the level of consciousness, communication and speech and pain level. Check the patient is awake and alert level of consciousness. Give few questions, simple questions for your patient. You have to check patient's orientation in time, in situation, and in his/her personality. For example, Mr. Smith, what's the cause of hospitalization? Are you having any pain right now? Can you measure the pain from 0 to 10? Mr. Smith, can you tell me where you are? What's the reason uh, of hospitalization? What's the season now? What's your favorite actor? Why are you here? Now I give you a few words and I will ask you later these words. For example, dog, cat, and fish. Examine the head, integrity of the skin, bruises, pain. Examine the face, symmetry. Can you smile? I am looking. It is symmetrical face. Is your mouth symmetrical? Are your eyes symmetrical? Can you look to your right and look to your left? Can you close your eyes and open your eyes? Inspect face. Check for symmetry, color of the skin. Examine eyes. Inspect eyes for redness. Note if the patient wears contacts or glasses. And inspect for sclera, extraocular movements. Examine the mouth. Ask patient about swallowing. Palpate the head or neck for obvious abnormalities. Inspect head. Check hair distribution and skin integrity. Inspect neck. After that, inspect patient's chest. Ask your patient about heart and lungs diseases. Inspect thorax, chest cavity for symmetry, bruising, surgery, scars, symmetry during X and inspiration. Palpate chest wall for tenderness if indicated. After the chest examination, we must auscultate the heart. We should place stethoscope to the apex of the heart, and it's important to analyze regularity of the heartbeats. You can hear lap dap, lap dap. Examine back of your patient. Ask about pain. Check symmetry of the chest. Examine abdominal wall. At rest and during breathing. Symmetry. Auscultate abdominal sounds. Using 4 quadrants. Examine upper extremities of your patient. Check the quality of the skin, symmetry, able to perform movements. Check muscle strength. Palpate pulse. Use both hands for pulse palpation. Test hands muscle strength. Check muscle strength. Symmetry. Examine lower extremities of your patient. Check muscle strength, hip for stiffness, endo pain, skin for color, temperature, bruising, skin breakdown, and hair distribution. Inspect feet, overall condition, bony prominences for skin breakdown, nails. Palpate edema. Palpate pulse on dorsalis pedis artery and tibialis posterior artery. If needed, popliteal pulse bilaterally. Perform BP measurement, pulse, breathing rate calculation, temperature measurement, height, weight measurement, BMI, waist-hip ratio calculation. See the checklist. Ask your patient relatives about questions. Return back to lowest height with brakes locked and appropriate side rails up, and call light bell in reach. Open the package and remove antiseptic napkin. Clean the diaphragm of the stethoscope and the olives. Place napkin stand depressor into the waste container. Packages paper should be placed in a container for non-hazard waste. Take off gloves if you used it and put it into the proper waste container. Perform hand hygiene record of procedure in medical record chart.